So today I'm just doing my skill re-demo for my pediatric assessment. So I have my sister as my patient and Cassie as the mom. And this morning for vitals, we did her height and her weight, plotted that on a growth chart, and I also assessed her gait and it looked good, so I'm not going to do that part. I'm just going to go ahead and go in and do my head to toe assessment. So I'm just going to knock on the door, knock knock, close the curtain for privacy, do my hand hygiene. Hi, my name's McKenna and I'm going to be the student nurse today, okay? And I'm just here to do your morning assessment. Is that okay?
Yep.
Okay. And then how's mom today?
Good. How are you?
Good. Sydney, can I just get your full name and date of birth from you?
Sydney Sandstrom, September 21st, 04.
Okay, perfect. And so that makes you what grade in high school? Sophomore. All right. Do you play any sports?
Basketball.
Basketball. All right. All right. So we're just gonna go ahead and I'm just gonna ask you a few questions just to assess level of consciousness. So can you go ahead and tell me the date?
January 29th.
Okay. How about where are you at right now?
Tioga Medical Center.
Okay, perfect. And then I'm just going to check your bracelet here, verify. Any allergies I need to be aware of?
No.
No? Okay. So I'm just going to go ahead here and get a little health history from you and mom. So any past surgeries that you've had that you can think of? No, nothing? Okay. How about any medications? Prescription, over-the-counter, vitamins, supplements, anything? No? Okay. And then during this too, I would also just like assess her overall appearance. So does she look sick, in any distress, dark circles, pale, anything like that? Which she doesn't. She looks just fine. And then I can go ahead and go do my vitals. So I'm just gonna do your pulse first, if that's okay. So I'm just gonna feel your wrist here. Okay, so my pulse would be 84. And then I don't have a pulse oximeter, but if I did, I would go ahead and put that on there, on her finger. So we'll just say her oxygen level is 98. And then I can go ahead and do my respiration. So I'm gonna go ahead and count those for a minute. Okay, so my respirations would be 18. And then I can go ahead, I'm gonna feel for your brachial pulses too, if that's okay. Okay, and they seem to be strong and bounding pulses, +2, so they sound good. And now I'm just gonna go ahead and get your blood pressure, if that's okay. You want it to be right about here, 2/3 of the arm, and then pretty snug, so you can get a good reading. So lay your arm just about like that, perfect. Okay, so blood pressure looks good. I got about 117/85. So that's good. Put that down. Oops. My pencil. Okay, and then I'm just gonna go ahead and get your temperature. If I had a tympanic one, I would do that, but I don't. I have a temporal one. 98.2 is her temp. I'm just gonna go ahead and write that here. And then I'm just gonna start my head to toe assessment. So starting at her head, I would look for my general appearance, like I said, dark circles, anything like that. And then I would go ahead, assess her eyes for any drainage, which looking at her eyes, there's no drainage. I would use my pen light and do perla, making sure her pupils are round and reactive, which they both seem to be. I would check her nose, make sure there's no drainage there. Her ears, checking for drainage, symmetry, all of that. And then I would feel her lymph nodes here. making sure that they're not swollen or anything like that, and that they look symmetrical. And then going from there, I would go down to her chest and her abdomen, so making sure she doesn't have any chest retractions or labored breathing, nostril flaring, anything like that, which she doesn't seem to have any of that. She looks like she's breathing pretty normal. Her skin color is good, its temperature is good. So then I'm just gonna go ahead and listen to her heart and lung sounds and her abdomen. So we're just gonna go ahead. Here's Sydney, and I'm just gonna listen to your heart first, and then I'm gonna listen to your lungs, okay? So when I listen to your heart, just take normal breaths, okay? So starting here, I would go here. And then I would want to listen to her apical pulse for a full minute, so I'm going to do that, which is at your 5th intercostal space and your midclavicular line. So I'm just going to go ahead and do that. So right about here. Okay, so that sounds good. No murmurs that I can hear or any heart sounds that are irregular. I'm not hearing anything there. But if I did, I'd want to make sure to document it and then notify the provider. And so now I'm just going to go ahead and listen to your lung sounds, okay? So just go ahead and take deep breaths for me. So I'm going to listen to them on your front and your back, okay? So just take deep breaths each time I move my stethoscope, okay? Okay, and then I'll have you lean forward and then just keep doing with the big breaths, okay? Okay, and her breath sounds also sound good. I would make sure I compared my upper lung sounds to my lower, which they both sound about the same. They sound good. And so then after that, I would go ahead and I'm gonna have her lie down and I'm gonna palpate her abdomen and listen for bowel sounds. So if you just lay down for me, Sydney, for just a second. I'm just gonna first look at it, obviously. Looks okay, there's no tenderness anywhere, is there? On your stomach? No? So we're just going to listen first. Start here, actually. Okay, so that sounds good. And then you have no tenderness anywhere if I'm touching? No? Okay. You just want to do light palpations and then the doctor would do any more if he needed to. So then after that, then I'm just going to go ahead and move down towards my feet. So I'm going to, just going to take your sock off, Sydney, okay? So I'm just going to remove my sock here. I would check my cap refill on her toes, which looks good. Actually, can I see your fingers as well? Because I need to do that on your finger too. Okay, looks good. And then I'm also going to feel for my pedal pulses, so I'm just going to find those on the top of her feet here. And count those. Okay, perfect. That seems normal. So let's put your sock back on here for you. Okay, and then you can go ahead and sit back up. And then I would also make sure to know any, if she was on oxygen, had an ostomy, or anything that was out of the ordinary or anything like that, that I would need to make sure I assessed and documented. I would ask if you guys have any questions, if Mom has any questions, or if Sydney has any questions for me.
No, I think we're good.
Nothing? All right, and then the provider will probably be in later, and I'll give him all the information from your assessment this morning, and he'll probably come in later this afternoon, okay?
All right. Thank you so much,
Yes,
Ms. McKenna.
thank you. And then I would do my hand hygiene, ensure privacy, and then I would be done.